this is a mixture of different things. When I spoke with Orla originally about what's the best use of me for you, it seemed that perhaps looking in some detail at what happens to children or adolescents when their mothers have drunk during pregnancy. So we're going to look very briefly at the international view, not a lot because Catherine did it beautifully, and that's been great. That saved me a lot of time. Thank you. A brief overview of diagnosis, looking at some of the behavioural problems, and what I've done is I've broken down the behavioural problems by age because they do change as young people get older. Some of the physical problems, and the physical problems are just really now beginning to be recognised. I'm glad that they're being recognised because to a large extent one of the ways that people can avoid, and when I mean people, I mean health professionals, one of the ways health professionals can avoid this issue is saying, well, it's a behavioural problem, so really it's not, we don't have much to do with behavioural problems. But it's also a physical problem. This is a whole body issue. And then very briefly at transgenerational aspects. Work. Okay, Catherine's already done this, but this is looking at the, no it's not. I will get better, I promise. This is looking at the pool prevalence, alcohol use during pregnancy in general populations from a variety of different countries. Now, you have to be careful with this kind of statistical analysis because you're not comparing like with like. It's the different ways that people measure alcohol, it's how well studies are carried out. These studies were all carried out well, but still be careful with it. The thing that really is probably of most interest to you is this one. This is Ireland. So, top of the league in this one. Denmark next, UK next, and then you've got a whole variety of things, Russia, Czech Republic, Australia, Ukraine. But Ireland's up there on the top. This is another one that is useful. It's looking at the national, regional and global prevalence of alcohol use during pregnancy and FAS. It was a systematic review, it was a meta-analysis, it was a good piece of work. And as you can see, and as Catherine's already told you, we're in the dark blue, Ireland, the UK and a lot of Europe. And this is the prevalence of people with FAS among the general population. And again, really, it follows to a large extent the actual number of people who are drinking. So you can't have a child diagnosed with FASD if you've not drunk when you're pregnant. It's not that simple, but that's the message. So if we look at the diagnostic criteria, I just had tea for breakfast, honestly. Maybe I should have had a drink. Maybe that would have been better. Diagnostic criteria. There are 4 categories. There's growth. These children are short in length, they're light in weight, and they have a smaller than normal head circumference. They have for fetal alcohol syndrome, they have a classic set of facial features. And I'll show you that in a minute. The bottom line is, this is brain damage. So it's the brain that is the issue in terms of the harm. And to get a diagnosis of fetal alcohol syndrome, initially at least, you had to have a measure of maternal drinking. And that's one of the difficulties, actually getting that measure of maternal drinking. For some of these children who are very severely damaged, their mothers may still not be alive. And people may not have asked them about their drinking, so that's an issue. These are the facial features. Oh, good. As you can see, these children look very sweet. They're cute. Their facial features are clustered in the centre of their face. They have short palpable fissures that it looks as though their eye aperture it looks as though the nasal bridge is broader than normal. It's actually their eye aperture which is smaller than normal. They have short upturned nose, and they have the next major factor that's obviously visible is they have an indistinct philtrum. This little lumpy bit between your nose and your upper lip is completely flat. and the upper lip is narrower. You see, I love that. You see people start going like that? You see all that's the sort of classic fetal alcohol syndrome features. The problem with that is a huge number of children who are severely brain damaged do not have those facial features. So over 70 to 80% of children with brain damage due to alcohol will not show up on these features. So they will not technically be able to be diagnosed as having fetal alcohol syndrome. They will have fetal alcohol spectrum disorders. And this is the diagnostic guidelines. This is the one that's used by most of North America and a number of countries in Europe. And you can see by that, flat philtrum, narrow upper lip. This is seen as normal, and this is seen as full-blown FAS. Of course, different groups, different cultural groups, different racial groups will have different features. The problem is that to a large extent it hasn't been recognised, and the new DSM-5, which came out 2013, it did not put in neurodevelopmental disorders, prenatal alcohol exposure. It was not listed in there. It was not managed to get in there. If something's in DSM-5 and ICD-11, which will be coming out soon, it makes a difference. It makes it respectable. In terms of diagnosing, it makes it respectable. The good news is it was included in the appendix under conditions needing further study, and that it's now classed as neurodevelopmental disorder, prenatal alcohol exposure, which in some ways may take away from the moralistic tone of it. It's not fetal alcohol syndrome, it's neurodevelopmental disorder, prenatal alcohol exposure. Does that make sense? It changes it a bit, it switches it a bit. Simple view of causation: the quantity of alcohol consumed by mother during pregnancy, the pattern of alcohol consumed, the frequency of alcohol consumed, and the timing of drinking in relation to the period of gestation. Catherine was talking about binge drinking or heavy episodic drinking. It's the highest risk for the fetus. It's also been our pattern of drinking for centuries. Binge drinking isn't new. We've always drunk that way. All that's changed, and it's an important change, is the amount we drink on each occasion. So, in terms of the critical period, you can see within that first matter of weeks, central nervous system and the heart are being developed. So alcohol consumption within that first 12 weeks, that first trimester, is the most toxic for the baby in terms of organ damage and brain damage. Again, for brain damage, the last trimester, where a lot of the growth spurt starts. But one of the problems, of course, of that is a lot of women are pregnant for at least 6, 7, 8, 9, 10 weeks before they know they're pregnant. And they will continue to drink in their pre-pregnancy way, simply because they don't know they're pregnant. I have never met a woman yet, and I've met a lot of women who with babies that are damaged. I've never yet met one that did it intentionally. It's not intentional. This is tragic, it's not intentional. Okay, behavioural aspects. One of the difficulties for some of these children is it's not diagnosed. This is not a syndrome that is diagnosed very easily, and often not diagnosed for a multitude of reasons which we can go into later. But they will often be diagnosed as failure to thrive. Short in length, light in weight. They have difficulties with feeding. They have difficulties in establishing a regular sleeping pattern. They're irritable, hyperactive. They have frequent bouts of illness. They have delay in reaching milestones, and they're indiscriminate. People are interchangeable. So that sense that a mother gets when her baby smiles at her for the first time and the midwives say, yes, it's just wind, but you know. It's not there. One of the features that continues throughout the whole of life of these young people is the failure to grasp cause and effect. They do not grasp. If you do something like you bite the tail of the cat, cat's going to bite you. They don't get that. And it's really very difficult for them, and it's incredibly frustrating for other people. They do not understand that. By the time they're 3 to 5, actually, it was something you said, Catherine, remind me about breastfeeding. Alcohol does affect breastfeeding. It doesn't affect the caloric intake of milk, but it does affect the amount of milk the baby will get. So the baby's going to wake up sooner. So if women are going to drink when they're breastfeeding, do it at 7 o'clock at night instead of 9:30 when you're going to feed at 10. It's a practical way, but it does affect the amount of milk the baby gets. Okay, 3 to 5 years. These kids are easily overwhelmed. They may have temper tantrums, usually to do with fear. They may be physically aggressive, again, down to fear. They react badly to and resist change. They're unable to learn from experience, and they're accident prone. They're often quite uncoordinated. And they're fearless, and they're unable to comprehend danger. Okay, by 8 to 10 years, they have mood swings. They have difficulty with self-regulation. They really have difficulty just controlling themselves. And one of the ways that can be helped with that is this kind of thing, this squidgy toy thing. It's often very useful for them if they're sitting in the classroom. If they have something like this that they can just squeeze, it stops them being quite so fidgety. Problem is, some teachers say these are toys and they don't allow the children to use them. Can you see how it gets complicated and unnecessarily complicated? Okay, they have problems with planning and the sequencing needing in a lot of tasks. Get ready for bed. Sounds simple. You've got to get out of the room you're in, switch the television off, get undressed, get washed, get your PJs on. That's 5 things. So get upstairs, get dressed, get undressed and get ready for bed is a complicated thing. We all know how to do it. It's like driving a car. When you start doing it, it's much more complicated. For these kids, they never get past starting to do it. And they confabulate. They don't lie, but they have gaps in their memory and they make up something to fill the gap. And that's one of the bits that's difficult. They really don't get a lot of the problem. A lot of the problems they have, they don't understand what's happening. This is one of my favourite slides. I have no idea what time we're in, so give me a yell. Thank you. A mum I spoke with in Vancouver one of the times I was there had a little boy with a skateboard, fetal alcohol syndrome, and she kept saying to him, "Put your helmet on. Put your helmet on. If you're in the skateboard, put the helmet on." And he did. And she came home from work one day and she saw this little kid coming sliding down the hill right across the road in front of her car onto the other side of the road. So she stopped her car and he said, "Look, Mum, I've got my helmet on." Didn't get it. Living with these children is really exhausting. Okay, 10 to 14. Initially, these children may be seen as having quite a high IQ, and in fact, a lot of these children do have a high IQ. It's based on language skills, but they don't actually understand the language that's being used. So they have a lot of words, but the quantity of them masks the quality. They don't really understand. If you're asking them to do something, they don't really get it. And you'll say, "What did I tell you?" And they'll parrot fashion repeat it back to you, but they don't actually take it in. Some of them have speech problems. They get lost quickly in conversation. They get bored and tired, and then that causes problems. And they have little understanding of social norms. They have little understanding of social distances and problems around that. And there's also, by that time, an increased risk of drink and drug use. 14 to 18, into adulthood now, they have no sense of personal space or boundaries. They may be sexually inappropriate. They don't understand risks. They may be overly affectionate with people. They don't get it. They don't get those social cues. They may be teased or bullied by other adolescents, or in turn they may bully or frighten others. They move through extremes of behaviour in short spaces of time. And the number of diagnoses that they have gathered by that time, the alphabet soup of diagnoses that young people can get, adds up. And a lot of them by that time will be diagnosed with conduct disorder. They burn people out. These are exhausting children. But it's exhausting for the children too. They're not happy. They don't enjoy where they are. By adulthood, their judgment and critical thinking are poor, so they often get into a lot of trouble. they lack social skills, they blame others for their own mistakes. They may become involved in criminal activity, not necessarily, but I will guarantee you, and one of the things we're looking at in Scotland now is FASD and criminal justice, I guarantee you a lot of the people you have in prisons will have some prenatal alcohol exposure, and sending them to prison isn't necessarily the best thing for them. They often have mental health problems, they often have depression and high degrees of anxiety. And just to try, I know you can't read this, it's to try and make you understand how confused these young people are. This is a young woman who was in a youth detention centre. Dear Mum and Dad, I'm having the best time of my life in youth detention centre. You're not going to try and help me because I don't have a drug or alcohol problem. The only problems I have started at home. I would just like to clear this for the record. You're not my real parents. I'm not your real daughter, okay? I'm never coming back, never. I hate you both and you can rot in hell for all I care. Love from, P.S. please write back, smiley face. How do you deal with that? How do you make sense of that to even try and respond to it for the young person themselves? Okay. 2 studies. I'm actually going to focus on one of them, a Canadian study describing a survey of adults and adolescents with a diagnosis of FASD. This was, trust me, a group of young people who got together. It was actually at a conference, young people with fetal alcohol syndrome. And they began to talk of this physical harm that they were experiencing. One of them was saying, I have to go to the doctor, I've got another ear infection. And somebody else said, well, I get ear infections too. And somebody said, well, so do I. So they began to think, maybe we should do something about this. Maybe we should be trying to get people to look at the physical harm that we as young people with FAS. Not just the behavioural problems, but the physical problems too. So they got the help of colleagues, Professional Joanne Weinberg and Professor Ed Riley, both well recognised and respected in the field, and they designed a questionnaire. And the questionnaire, being young people, thought was the best thing to do was use the internet. So they sent out this questionnaire to anyone who wanted it, who had a diagnosis of fetal alcohol spectrum disorder. Now they had to be able to put the doctor's name of who gave them the diagnosis. So these weren't just anybody playing games, these were children who had actually been recognised as having fetal alcohol spectrum disorders. And they got a really interesting series of things back. There were about 260 items. I'm just keeping going, yeah? Power's off. And they went through a variety of different things. They looked at autoimmune disorders, at heart problems, problems with bones, joints, muscles, visual and hearing problems, endocrine disorders like thyroid problems. What they got back was fascinating. In terms of ages, most of the people who answered the questionnaire were between 16 and 30. That accounted for about 65% of the people who responded. And some of the people who responded needed help to respond. You know, they weren't necessarily able to complete it themselves, but they got help to fill in the questionnaire. What was interesting, by the time people were over 60, there was only 2% response. Now, part of that might be that by the time you're 60, and believe me, I know what it's like, using the internet is not necessarily something that you take too easily. Of course, the other issue, and probably a high probability, is a lot of these people do not survive into old age. They die relatively young compared to average ages. In terms of the gender of the group, 44% were female, 44% were male, and there were some who would rather not say, which was interesting. 49% of them said they'd been diagnosed with fetal alcohol syndrome. Some of them with partial fetal alcohol syndrome, alcohol-related neurodevelopmental disorders, fetal alcohol effects. Static encephalopathy was one of the other ones. What is now being recognised, certainly in Canada and North America, is fetal alcohol spectrum disorder, which we initially spoke of as an umbrella term, as Catherine was saying, is now recognised as like any other of these spectrums of disorder. So fetal alcohol spectrum disorder is now used as the recognised form. And I'm going to, I'm sorry you can't see it because nothing's happening. And I'm just going to go through one or two of these. In terms of rheumatoid arthritis, they compared the group that who had answered their questionnaire with the general population in North America. Okay. For rheumatoid arthritis, they were reporting a 12 times higher rate than the general population. For celiac disease and Crohn's disease, gut problems, 4 times higher than the general population. Asthma, 4 times higher than the general population. 4 times more likely to carry an EpiPen. So this isn't just a bit of a runny nose, this is serious problems with allergies and with immune problems. Chronic ear infections, 142 times more likely than the general population. 142 times more likely. A lot of these young people have problems with their hearing and it's not picked up. So sitting in a classroom, they're not even hearing what's being said. Not that they're not interested, it's just that they have problems actually with hearing what's being said. A lot of them have heart problems. Congenital heart defects, 23 times higher than the general population. Hypertension at the ages of 18 to 44 is twice as high. And supraventricular tachycardia, that massive racing of the heart, over 100 beats a minute, very unpleasant and frightening, 27 times higher than the general population. One of the interesting things about a lot of these young people is they have a very high pain threshold. They just do not understand pain, they don't get it. CJ, who you'll meet a bit later, has a problem with dislocating knees. CJ walked around on a dislocated knee. But these children have a lot of problems with joint difficulties, and because they have a high pain threshold, if they go to accident emergency with something, because it's not quite right, they've got a swollen knee, for instance, and the health professional said, is it painful? They say, well, not really. And they say, well, it can't be any big deal. Can you see how just all along the way there are these confusions and lack of connection? 10 times higher than the general population gout. Gout's not that common. 10 times higher in young people. Are we anywhere near it? Nope, just keep going. Problems with hearing. Hearing loss as children. 75 times higher than the general population. 75 times higher. So if you're in a classroom with another 30 children and you're sitting at the back and you don't open your book at page X and the teacher gets annoyed with you, it may be simply not hearing it. Hypothyroidism, clinically evident hypothyroidism, 160 times higher than the general population. Acute sense of smell, 55 times higher. Now that may sound not particularly problematic, but actually, if you go into a restaurant sometime and someone's serving fish and you think that fish smells a bit iffy, these children smell these things long before we do, puts them off. So they have difficulty eating. They have difficulty sometimes with the texture of food. I remember a little boy that I used to see who used to loved peaches, but he had to eat them with a knife and fork because he couldn't touch them. So some of these things seem simple, but actually the implications of them can be quite serious. 35% of them reporting they don't feel hungry. They have to keep being reminded to eat because they forget, because they're not hungry. Oh, good. Seizure disorders. Seizure disorders, 21 times higher than the general population. And the seizure disorders in part are related just the brain damage that these children experience. Sleep disorders. Do you know, and I'm sure some of you have experienced this or have children who've experienced it, if a child does not sleep, if a child with fetal alcoholism syndrome or fetal alcohol spectrum disorder doesn't sleep, nobody in the family sleeps. Because they're up at 3 o'clock in the morning and they're banging around and they're wanting to play games and they put the lights on, they put the lights off and they jump up the stairs. Sleep disorders on a child affects the whole family. Problems falling asleep, 7 to 14 times higher than the general population. Problems staying asleep, 6 to 11 times higher. Sleep apnea, 6 times higher. Oh! Problems with short-term memory, 80%. 80% problems with short-term memory. What did I ask you to do? I just told you 3 minutes ago. What did I ask you to do? You're not paying attention. But the difficulty, if there's a child in the family with fetal alcohol spectrum disorder and the other children don't have problems, one of the children that don't have problems does something and the mother said, "How many times have I told you not to do that?" She never says that to the child with FASD because she knows they keep forgetting. So the normal child says, "Why do you keep blaming me when you never..." Oh, I'm going to give up. When you never give him a ride. So even within a family, having a child with this particular syndrome, and I know that's not different from many syndrome of learning difficulties, even within a family, this can cause problems. 88% of them have difficulty with paying attention. They cannot sit still, and that's why this kind of thing is so useful. And they have problems making decisions. Throughout their lives, they have problems making decisions. A lot of these young people will not be able to live on their own. Occasionally, they'll find somebody and they'll live with that person, and that person understanding them will help them through life. But they have real difficulty with the kind of things that, as an adult, you expect people to be able to do. Having said that, I have to buy myself a new car, not a new car, another car. I'm scared shitless. I really am. I've already test-driven 3 and I can't make up my mind. Now, my brain is relatively normal. Can you imagine what it's like for a young person who doesn't have that? The whole world is scary. The whole world is scary. Oh, I'm forgetting this one now. Difficulty with judgment, they can make poor decisions, 81% of them. They have difficulty in understanding what people are saying to them, and they have difficulty in understanding what they read. They have a lot of difficulty within the criminal justice system, and I think we're just beginning to understand that. They will appear to understand what the judge or the lawyer is saying, and they'll be able to repeat it back, but they won't actually understand the concept of it. And so they'll say yes, and they do it so frequently. If they get into trouble, they'll go in and the police officer will say, "Well, we know you did this, so if you just admit to it, we'll all be a lot happier. So you did do X." And they'll say, "Yeah." They may not have, but they want to please people all the time, so they'll say yes. This is a sensitive subject. It's emotive. It carries with it huge moral judgments. It causes problems amongst my feminist friends because they say it's a view of women as nothing more than a vehicle for the next generation. But over the years that I have worked in this field, I have learned women do not become pregnant alone. It tends to take 2. So although I focused on the women, and that is the focus of the day, men are not lacking in a responsibility for this. We do know that alcohol affects sperm count, it affects sperm motility, and it can lead to subfertility. And that might be the safest thing. Sorry. But it takes 2. And if the young woman stops drinking when she's pregnant, if her partner stops drinking too, then the chances of her continuing to stay not drinking is higher. And this is the other one, and I think I'll leave you with this slide because it takes a bit of time. Catherine was talking about mothers and daughters earlier, The egg that made you was developing in your mother when she was a 6-week-old embryo in your grandmother. So it's not only prenatal experience that counts, it's prenatal experience. There are transgenerational aspects of this. The good news for Ireland and for most other countries is that grandmothers were far less likely to drink than women are now. And that is a positive in this respect, it's a positive. But egg developing in your mother when she was a 6-week-old embryo in your grandmother. Is that not scary? Okay, I am sorry about the problems with the technology. That's my email address. Please, if you want to get in contact with me, do so. And I'll be around for the rest of the morning if anyone has any questions. Thank you.